afternoon, everyone. We're thrilled to welcome you all to another exciting and inspirational holiday episode of Concorde Conversations. This is a new initiative by Concorde Medical Group to educate, empower, and encourage our community to improve their health. Today's discussion is heartburn and the holidays. Hi, I'm Dr. Catherine Weinberg, Director of the Adult Congenital Heart Disease Program, and I'm joined by two amazing and fabulous women and brilliant colleagues. We are joined today by our return guest, Dr. Ishita Dwivedi, and introducing our outstanding gastroenterologist, Dr. Liu. Many of you have already sent in excellent questions, which we will be discussing today. If you have additional questions, please ask them in the chat box. Remember, we only have 30 minutes together, so we're going to go through as many as we can. We are giving general guidance today. If you have a particular question about your health, we want to help you. So come in for an appointment so we can answer your questions and give your health the attention it deserves. Let's get started. So, Dr. Liu, what is heartburn? What is GERD? And what are the symptoms?
Thank you for having me first. And GERD is a gastroesophageal reflux disease. So it is a condition when the stomach content gets up into the esophagus, which is our food pipe, and this can result in symptoms, for example, heartburn. So what is heartburn? So heartburn is a burning sensation, a kind of a burning pain. This could be in the upper part of your abdomen, could be in the middle of the chest, and it can be even up to the neck region. And some other typical GERD symptoms include regurgitation. That means like the stomach contents coming up towards the mouth without any effort. Of course, sometimes people also complain about chest pain that could be related to acid reflux as well.
All right, Dr. Dwivedi, how do you tell the difference between chest pain from reflux and chest pain from the heart?
Yes, so basically your heart, your food pipe, and your stomach all lie within a very close vicinity. So oftentimes the symptoms can overlap, and oftentimes people who have heartburn may actually have heart disease or may think they have heart disease and have heartburn as well. Typically, we do say if your symptoms are worse with exertion and get better with rest, that's more concerning for heart disease. And typically, if you're eating something, especially trigger foods that we'll go over later in the talk, and you feel discomfort in the chest, that's more likely to be heartburn. However, as a cardiologist, I would like to say that it's always good to take heart disease off the table, and heartburn is more a diagnosis of exclusion. So if you're worried, then you should definitely get checked out.
Exactly. So if you ever get chest pain walking up the stairs, go see Dr. Dwivedi. Okay. So why do you get heartburn, Dr. Liu?
So this is usually because of the barrier between the food pipe, the esophagus, and the stomach. The barrier is not functioning right, and that's when we have the problem. So we do have, you see a cartoon pictures here, and then we do have muscles there to coordinate the opening and the closure of the barrier. It's like a valve. When we eat, the valve opens. When we finish eating, the valve is supposed to close. However, if the valve is not closed tight, the stomach juice can get up into the esophagus easily and our food pipe. And this can give people symptoms.
Got it. So could a chronic cough be related to heartburn, Dr. Dwivedi?
Yeah, so believe it or not, but chronic cough is one of the symptoms of heartburn. And that's mostly because, like Dr. Liu said, the acid from your stomach can come up into your food pipe and your throat, and it can irritate the lining, and that's what leads to chronic cough. Other common causes of chronic cough could be postnasal drip or asthma, but certainly if you have risk factors, you should consider heartburn as one of the diagnoses.
Great. So Dr. Liu, how do you diagnose reflux?
So for patients with classic GERD symptoms like heartburn or regurgitation, but without any other like alarm features, for example, trouble swallowing, vomiting, weight loss, or anemia, we usually do a trial of PPIs, which is an acid reduction medication. If they responded to the treatment well, then their symptoms were likely from GERD. That's one way to diagnose GERD. We call it a trial of medication. And then other ways to diagnose GERD, including a more objective test, which is a pH study. For example, we can place a wireless capsule, we call the Bravo study, place this capsule and attach it to the esophageal mucosa, which is the lining of the foot pipe. This can be done with an endoscopy procedure.
Got it. All right, Dr. DeVetti, what can we do to prevent or reduce symptoms of reflux?
I think understanding what is precipitating your reflux is important. So avoiding trigger foods, that we'll go over later. Also avoiding eating very late at night, because if you eat late at night and you lie down, it increases the chances of the acid refluxing into your food pipe as well as your throat. And certain lifestyle modifications like weight loss helps a lot with acid reflux as well.
Absolutely agree with that. So overweight, especially for central obesity, is one of the major factors contributing to GERD. So it's actually similar to the fact that 2/3 of pregnant women experience heartburn, especially during the third trimester. Why is that? Because the abdominal pressure from the baby in the uterus can easily push the stomach content into the foot pipe, our esophagus, and then similar to central obesity, that increase the abdominal pressure that could make heartburn worse.
Great. So, what else can you do in the evening to reduce acid reflux?
So I usually tell my patients that a couple like mechanic tricks can do the trick. So for example, elevating the head of bed when you're sleeping, that can make the acid harder to go up to the foot pipe. I really don't recommend just put like a couple pillows like under your head, because this actually only going to elevate gonna bend your neck and then make your neck hurt. So I usually recommend a wedge, like a bed wedge that you can easily Google and then buy it, and then elevate your whole upper body so that you make the acid harder to go up to the foot pipe. Another thing I talk to them is to avoid late dinner, your last meal, or and also avoid the bedtime snacks. Wait at least 2 to 3 hours after your last meal before you go to bed, before you lay down.
Let's talk about some common holiday foods. What can you eat and what can't you eat? What about alcohol, having a glass of wine for dinner?
Yes. So, unfortunately, like most things in life, everything that tastes good is probably a common trigger of heartburn symptoms. So some common foods that can trigger heartburn are chocolate, anything containing peppermint, acidic foods that like tomatoes. I know we obviously use a lot of tomatoes in pastas and stuff. And then spicy food can also trigger heartburn. Sometimes things like nuts can also trigger heartburn for patients. And when it comes to alcohol, like I say, everything in moderation. Don't overdo it with alcohol. Obviously, the more quantity you drink, the more likely you are to have heartburn symptoms. But, obviously, we do want to enjoy our life, and quality of life matters as well. So if you wanted to have a glass of wine over dinner, that's fine. But obviously, limiting alcohol always improves your symptoms.
Totally agree. The rule of thumb is portion size. Do it moderately. Listen to your body. Your body gonna tell you when it's time to stop. Or your previous experience. If 2 glasses of wine give you the heartburn problem, and then maybe try just half a glass and see if that works. The larger the portion is, the more acid our stomach will have to produce to help digest, and then the higher chance people may get heartburns.
Let's talk a little bit about over the counter medications. Do you have any recommendations?
Yeah, so fortunately there are multiple available. The common ones that we usually think of is Tums. Mylanta is a good one. And these medications mostly work by sort of decreasing the acidity in the stomach as they neutralize the stomach acids. I know that Zantac is also commonly available over the counter. That works a little bit differently by working on the enzymes in the stomach that help to produce the acid. Obviously, if you're needing them on a regular basis or very frequently, then it's time to consider further diagnosis and seeing a gastroenterologist.
Okay, Dr. Liu, when do you switch from over-the-counter to prescription medications? And can you talk about the most commonly prescribed prescription medications?
So I agree with Dr. Devati. And when you have to take over-the-counter anti-acid medication more frequently than you think, and then you should probably speak to your doctor and then about the alternatives and then what's going on. And the most commonly prescribed medication for GERD, for heartburns, is PPIs, we mentioned briefly previously. So it's a proton pump inhibitor. So this kind of medication inhibit the pump on the stomach cells that decrease the acid production in the stomach. So they can also improve healing as well. So they work best when you take 30 to 60 minutes before breakfast or your first meal.
Great. Can you take those medications long term? And
Yes, you can. But usually for like uncomplicated heartburn, GERD symptoms, I usually recommend a course of 6 to 8 weeks. Then we can have a trial of medication while you're doing your diet and lifestyle modification. Sometimes people do need a repeat course when the symptoms come back, or sometimes people do need a longer course.
I would just like to add that yes, Zantac was recalled, so I was just going over the common things that people know, but going forward, it's probably not going to be available over the counter.
And then over the counter, we have Pepcid, similar to Zantac right now. And then that usually work pretty fast, like within like a couple hours, you'll feel a quick relief. And then that can help with the symptoms for usually several hours. Over the counter, you also see like a Prilosec, Nexium, and those are like a lower dose than our treatment dose. Usually those are good for like milder mild symptoms, heartburns, GERD symptoms. Usually they are not so much for like immediate relief of heartburns. They may take like 1 to 3, 4 days for the full effect, but then they do have the full effect do last longer.
great. So let's talk a little bit about interactions with other medications. Do some of these medications interact with your cardiac medications, like clopidogrel or Plavix?
Yeah, so a lot of patients that have stents or may have severe plaque buildup in the arteries of the heart typically need blood thinners, and one of the common ones we use is called Plavix or clopidogrel. There was some data where in the lab, in test tubes, they found that there was a potential interaction between omeprazole and Plavix. But in vivo, which means like when we studied patients, that interaction did not really pan out. So by rule of thumb, don't change any medications that you're taking without talking to your doctor. Typically, if you're tolerating it well without any adverse outcomes, we will continue it. But this is obviously a nuanced conversation that you need to have with your gastroenterologist as well as your cardiologist.
There's a question here about the fact that a patient's been taking medications for about 25 years. Do you produce less acid as you get older? Is it possible that you'll come off of it later on in life?
So this sounds like a very personal question, and I don't know the details. And then we have to figure out why you need to take this medication for 25 years. Have you ever tried to be off medications? What are the symptoms? Is that the typical GERD symptoms like heartburn or regurgitation that you're trying to control with PPIs? Or if something else, for example, chronic cough.
So in other words, come see you. Okay, let's see. What about PPIs and osteoporosis, Dr. Devati?
Yeah, so, obviously every medication we take, even the herbal ones, have side effects and there's benefits. And one has to see what the benefits are and the side effects, and then decide the duration and the kind of medication that you're taking. PPIs, like any other medication, do have side effects. There is somewhat of an association that if you use PPIs for a long term, that means years and years and years, it may contribute to osteoporosis. This is simply a link. It's not a causation, meaning it doesn't necessarily cause it, but we see it more commonly. What I would say is that if you have osteoporosis and you're on a PPI, it's important to consider how long you need the medication and if you should continue it, but definitely don't stop taking it because it's not a direct link that we found.
Great. Okay, let's move on to some of the procedures. What is an EGD and when should you get it, Dr. Liu?
So EGD is an endoscopy procedure. So we can examine your esophagus, your stomach, and duodenum, which is a part of your small intestine, with a scope and then the camera and the instrument channels in it. So we usually recommend EGD when people have alarming symptoms. Other than just simply heartburns. For example, trouble swallowing, vomiting, anemia, weight loss. So EGD is also recommended when people have incomplete responses to PPI treatment.
Can reflux lead to a chronic phlegm in the throat, Dr. Devetti, that doesn't go away with nasal decongestions?
Yeah, so like we had sort of talked about at the beginning, that the acid is not supposed to be in your food pipe or your throat. And gastroesophageal reflux disease is essentially that the acid can chronically irritate the lining of your food pipe as well as your throat. And that irritation long term can definitely lead to development of chronic phlegm. And especially if you're not, if you're needing decongestants for a prolonged period, like for example, if you have springtime allergies, but this is lasting beyond the seasonal changes, then definitely you need to consider gastroesophageal reflux disease as a diagnosis.
Okay, Dr. Liu, what are the long-term complications of heartburn and GERD?
So common complications include esophagitis, which is the inflammation of the foot pipe lining. Esophagitis can cause ulcers, bleeding, and chronic scarring. So the scarring can narrow the foot pipe, eventually leading to a trouble swallowing. So also long-term acid reflux can damage the lining of the foot pipe, which may lead to Barrett's. So most people, a lot of people heard about Barrett's. So Barrett's is the change in the cell linings of the esophagus, the foot pipe. So it is associated with an increased risk of esophageal cancer. Although the risk is small, it is important to have regular checkups.
Great. Okay. What about a hiatal hernia? How does that play a role in reflux disease? And is there anything short of surgery to mitigate these symptoms?
So hydrohernia actually could be an indication of the barrier of between the esophagus and the stomach not working properly. So I often in my clinic, I often draw pictures, and when I try to explain what's happening to my patients, you would think that I probably improved my drawing skills by now, but this is what I normally draw. You can see that it's similar to the picture that we showed you in the beginning. So this is the foot pipe, and then this is the stomach, and then the arrow that I'm trying to show you is the barrier that we're talking about. There are muscles here and then coordinating this job to open and close this kind of a valve. So when the valve is not closed properly, and the hydrohernia meaning that part of the upper part of the stomach can go up to the chest compartment, and then it's called hernia. So this actually predisposes you to have acid reflux problem and then make your heartburn symptoms worse. Depending on the size of the hydrohernia and depending on the symptoms, the severity of the symptoms, and also depending on how you respond to the PPI treatment, sometimes we do discuss like whether you would be a good candidate for anti-reflux or like a hernia repair surgery.
There was a question about what's the relationship between heartburn and a sensitive stomach.
It can be an overlap. Some people just have a sensitive stomach to certain foods, like some people have a sensitive stomach to dairy, let's say, but that doesn't necessarily mean that it's heartburn. Or some people have sensitive stomach to spicy food, but that doesn't necessarily mean it's heartburn. But definitely, if you have heartburn, it may be because you're eating trigger foods that can lead to a sensitive stomach or exacerbation of your symptoms. So while there's a little bit of an overlap, it doesn't always necessarily mean the same thing. Dr. Liu?
I agree with that. So sensitive stomach is also a little bit non-specific, and it could be just upset stomach and or pain, or the too much acid responding to the a certain food. So if people happen to also have the barrier problem, the malfunctioning of the muscles over there, and then people can also suffer from heartburns.
There is another question: is belching or burping a common way to minimize the feeling of heartburn? Dr. Liu?
Yes, sometimes people do tell me that burping helps minimize the heartburn sensation, and sometimes it is actually part of the GERD symptoms. So that can be oftentimes treated with PPIs, the acid reduction medication.
Great. So what is the best diet to be on to minimize reflux disease? Is there a best diet?
I often tell people that each body is different. The sensitivity to different food is different as well. And then we mentioned that there are common food that can give people heartburn symptoms. Like we mentioned alcohol, we mentioned the chocolate, peppermint, carbonated beverages, coffee, spicy food, acidic foods, or foods with like a high fat. Those are common food. But I also like heard from my patients that peppermint will make their heartburns better. So each one is different. I always say, listen to your body, and then you. It's sometimes necessary to take some like a dairies and to figure out what is your trigger food or trigger foods.
We have another interesting question in the chat box. Can you talk a little bit about silent reflux? When you don't actually get heartburns, but still have reflux. Can you say something about that, Dr. Liu?
Wonderful question. So we call those silent reflux atypical GERD symptoms. So of course, oftentimes, if depending on what kind of symptoms you have, for example, we mentioned the chronic cough. We mentioned could be some people could have like a change of voice. They could have like a acid reflux related asthma. They can feel the phlegm in the throat. We mentioned that earlier, and then constantly making them try to clear the throat. Those could be related to acid reflux altogether. And first step, we often say that we need to rule out other common conditions that can cause those symptoms, like allergies, like postnasal drips and stuff, sometimes pulmonary, like the lung diseases. And if those are all ruled out, and a couple of ways that we can try to figure out whether those symptoms are related to GERD, to acid reflux, we can do what I mentioned earlier, pH study. It is a wireless capsule study we placed into the food pipe, the esophagus, and then try to detect the flow of the acid going through the food pipe. And also the other good thing about this test is we can ask you to push the button where you have the symptoms, so that we can see the correlation, whether when you're experiencing this like symptoms, whether meanwhile you have increased the acid flow through your esophagus, and then we can see the correlation very well.
All right, Dr. Devetti, if you had one step to recommend to our viewers to improve their health and to start today, what would it be?
Yeah, I would just like to begin by saying that holidays are a time of excess. Holidays are a time of splurging. And I think that moderation is really the key. And remember that a healthy lifestyle is not a sprint, it's really a marathon. So if you lead a life of moderation and consistency and sustainability, that's really the best way to lead a long, healthy lifestyle.
Okay, what do you think, Dr. Liu?
So I mentioned that several times during this conversation time, listen to your body, because each body is different, and your body gonna tell you what foods are your trigger foods, when to stop, when it's too much for you, and then work with your body, work with your doctors. If you have any problem, any questions, you're uncertain about anything, always talk to your doctor.
Great. Well, thank you everyone for joining another inspirational and educational episode of Concorde Conversations. Please fill out our survey at the end of our Zoom to let us know how we're doing and what we can do to better serve your needs. We know that many of you have additional questions and we want to help you. So come in for an appointment. We care about your health. Happy holidays, everyone. We look forward to a bright and happy 2022. Thank you so much.
Happy
Bye.
holidays.
Holidays.